Hi, I'm Dr. Bolanle, your host on the BrightMindsMD and Your Mental Health podcast. Here, we discuss topics designed to explore the full spectrum of mental well-being. You'll hear from experts and listen to personal experiences that inspire and inform. So, whether you're seeking insights, solutions, or just a dose of motivation, this podcast is your perfect companion. Hit that subscribe button and join us on this incredible journey to mental well-being. Your whole health starts with your whole mind. Let's get started.
All right. Hello. Welcome everyone who's listening, and thank you for joining us today. My name is Dr. Akinronbi, psychiatrist and founder at BrightMindsMD, a practice in New Jersey where we help people with depression, anxiety, and other psychiatric concerns feel better using fewer medications and wellness practices. I'm excited to be joined today by one of my colleagues, Lauren. I'm going to have her introduce herself, my co-worker in the mental health space. Please tell us about yourself and welcome to our conversation today.
Wonderful. Thank you so much for having me. So I'm Lauren Grossbach. I'm a licensed marriage and family therapist. I practice in New Jersey, and I own a private practice called Mindful Connections Counseling. And we work with all different types of folks. It could be couples, families, individuals, children. Today, I'm going to be talking to you about how to help someone who is depressed. And so we'll talk about some of the techniques we can use, but our practice focuses on talk therapy and how to support yourself, but also your loved ones.
Awesome. Thank you so much. And thank you for making the time. I like that I like these collaborations when we, come from, some are psychiatrists, you're therapists, and we often work together and help people with different conditions. So I like when we get together and put our brains together to discuss how to better help people and explain to people how we help people as well. So as you mentioned, what we'll be talking about today is how to help someone who is depressed, how to help a loved one who's depressed, right? This is a question that comes up often, right? When people who are not our patients, or but family members of our patients wonder how to help them with depression. Before we jump right into that, I'd like to talk about depression. First of all, what will they be seeing? What would be the signs that people might be seeing in loved ones who are depressed before they even decide that they need help?
Well, I think we tend to think of someone who is depressed as someone who is sad and crying a lot, which can be true, but there are a lot of other signs and symptoms of depression that can pop up. And so there are things like increased anger. Sometimes someone who is depressed can present as very angry, but also isolated. Someone who's very isolated kind of keeps to themselves, doesn't really have that motivation. We tend to think of depression as this really low blue place, and it can be, but it can also be a very just kind of meh, not excited about life and not pursuing goals, little motivation. So you want to look out for those lesser known signs as well, not just the sadness component.
Absolutely. And thank you for highlighting that, because it's a really important one. Everyone kind of can sort of recognize sadness, but it's harder sometimes to recognize signs like irritability, I think is the term, when people are just angry all the time. And it causes problems in relationships without people realizing this is someone who needs help, because they're snapping at people, they're irritable, they're angry, and everyone's just mad at them instead of seeking help for them because they don't recognize that irritability can be a sign of depression. So thank you for highlighting that. And the other one, I think important one that you highlighted is the keeping to oneself isolation, where people then can get frustrated with this individual and say they don't want to go anywhere. I've invited them, it's my friend, they're keeping away. What's wrong? They're being snooty, and maybe they're not being snooty, maybe they are depressed. So thank you for highlighting these two not often talked about signs of depression that we can watch out for in our friends and family. So let's say someone has now observed these things in their family and friends. They're thinking maybe there's depression because of this combination of symptoms. How can we approach, or how can people approach their family and friends to talk to them about it? That perhaps, hey, you may need help. How do we do that?
This can be really touchy, right? Especially if they're isolating, if they're irritable, if you feel like you've lost your connection with them. It can be really hard to approach this sensitive topic. And I've heard from so many people that say, I don't want to go to my loved one and say, I think you need therapy, or I think you need medication, because that sparks huge argument in a lot of families for good reasons, right? It's a very, very touchy subject. And so what I recommend to folks is to approach it with care and concern, also to understand that it is a medical issue. And so we'll be talking more about that in a moment. But first and foremost, approaching your loved one with empathy and with love, and being able to ask some direct questions like, what's been happening for you lately? I noticed that I haven't seen you often and I miss you. Or you want to approach it with love instead of criticism or questioning, right? So rather than saying, why haven't you returned my calls? You might approach it and say, hey, I haven't seen you in a while, and I'm wondering what's happening for you. I know that last time we talked, you had this going on, or I know that you're dealing with this life change, or maybe it's nothing at all. Maybe it's just, I haven't heard from you and I really care about you and I want to know how you're doing. Giving your loved one space to just talk about what's happening. And I think a lot of us are used to saying, hey, how are you? Good, I'm fine. But make sure you give your loved one, when you check in, space to really say what's not going well.
What if they don't respond, right? Because we see that sometimes, and it's a question that comes up for me. So when people ask and check in, and people say, oh, nothing, I'm fine, nothing. Yeah. How do we tolerate that? How do we approach that?
That happens so often. And look, we can't force our loved one to open up, especially if they're an adult, right? We can't force them to tell us what's going on. We can continue just to show up. And so if they say, nothing, I'm fine, say, okay, well, if you want to get some coffee, or could I stop over sometime, right? You could try to give that olive branch to spend some time with them, to go visit them. If they still shut down, you just want to remain positive and present, and to say, I'm here, I love you no matter what. When you're ready to talk, if you want to talk, or if life gets down on you, I'm here for you. And just be checking in with them. And if every time they say, nope, I'm fine, that's okay, because by the 5th month that you ask, they might end up feeling safe enough to say, you know what, I've really been struggling and I want to talk to you about it. So it might take time to get there.
So keep being present and keeping the door open, really, really important for that conversation, because sometimes I get on the other end my patients saying, well, I've asked them. Well, I guess if they want my help, I guess they'll ask me, and I'm not going to keep asking them. I'm not going to be present, which could be counterproductive. So I like that you highlight the fact that they, we stay open, we stay present. It's not about us, right? If the goal is to be helpful to them, we stay present and stay open and keep the door open so that they can walk back in. I also wanted to highlight you saying, talking about safety. Like, we don't often, maybe are not often aware of that as the general public, how it can be hard for people to say that they're struggling, or to admit to us that something is wrong. And they may need to feel like, I can trust this person. They won't judge me. They won't look down on me, or they wouldn't think badly of me for having these challenges. And safety, I just really wanted to highlight that, because you said that as your very last sentence, and maybe you can go into that a little bit more, the idea of safety in developing comfort to talk about depression to others.
Right. And there's different levels of it, right? So you might witness your loved one who seems down, and you thought, yeah, maybe we can talk and I can recommend therapy. But on the other end of the spectrum, you might have a friend that you're really concerned about, or a loved one that you're really concerned about. You think maybe they can't keep themselves safe. Maybe they're having some suicidal thoughts. And so I want to add a caveat that if you have concerns about someone who might hurt themselves or others, there's 988, there's 911. So there are a couple resources in New Jersey, and I'm sure we can share some of those with your audience. As far as who can I contact if someone I love might have some thoughts of hurting themselves or others. But remember that, our loved ones are not there to triage the issue. We're just here to listen. And so open up the conversation. If you think that they're having struggles keeping themselves safe, then we can talk about accessing some resources and making sure that we frame it as, let me get you some help. You don't have to suffer with these thoughts and these feelings. This is not a matter of, I'm going to go and get you committed, but this is more a matter of, you deserve to feel safe. You deserve to be able to live your life fully. And so if that's not happening, let me help you find a resource that can get you there.
Yeah, absolutely. So when we're keeping them safe, we also want people to feel emotionally safe, that we're not trying to commit them to the hospital or do harm to them by our intervention, which can also help them feel emotionally safe enough to admit to us that they're struggling, or that something is wrong, or to admit at least to us that they might need help. Speaking of needing help and the medical side of it, right? Especially for something like depression, there's a lot of get up, stop being lazy and all of these other things. How do we communicate that? Or, how do we shine a light on that? The medical aspects of depression, I think it's important to talk about that more and more.
Yes, because it is a medical issue. There's still some stigma around someone who is depressed and their need to get up and exercise and push through it. And there are so many benefits to things like exercise and motivation, but we have to talk first about the medical issue of depression. It is a chemical imbalance. And so regardless of willpower and want and love and need, someone might find themselves feeling very depressed. And so it's important that we treat it as a medical issue and that we consult with experts. And so it could be a psychiatrist, it could be a therapist, someone in the mental health field to really understand what are the signs and the symptoms and what are my options for treatment. Because we want to be mindful to not approach our loved ones with some of the toxic positivity that we've seen of nice outside, go for a walk, maybe you'll feel better. Now, all of these things like walking and exercise, vitamin D, they can all be an awesome part of treatment, but in conjunction with other interventions as well. And so we want to be careful to not be giving our loved ones advice, try this and try that, have you thought about this? But more it's about helping them access the resource because it is a health issue, right? And if your loved one was diagnosed with diabetes, you wouldn't go to them and say, have you tried this? You would say, maybe you have to speak to your doctor because I don't know anything about that, but I'm here to just talk to you about it. So we want to approach it like we would any other medical issue.
So emphasizing getting medical care, and then we can have all of those other wonderful things as part of our adjunctive treatment approach. Speaking of getting treatment, also we know that there are beliefs within different communities about mental health care that sometimes get in the way. What are some things you hear commonly or common reasons that people don't seek professional help for depression, for example?
Right. So one thing I hear a lot of folks say, even in the mental health community, are why aren't more people accessing therapy and psychiatry? Why aren't they getting help? And so it's important to understand not only just the stigma in our environment around mental health and around someone who is depressed, but also different cultures, right? And so especially in a lot of minority cultures, there's a big stigma still with mental health, and for good reason, right? When we look at just, for example, maternal mental health rates in the Black community, and them seeking appropriate care and really being heard. And so that's something that I've heard about. I don't have lived experience with it, but it's something that I am aware of, is that a lot of folks in minority communities will go to their doctor, talk about their symptoms, end up feeling dismissed. They might be written off as dramatic or chaotic. Then that person walks away not getting those resources. And so for real reasons, we have folks in a lot of communities that are hesitant to talk to their doctor or access those resources. And so it's important that we just put that out there and also realize that that might be a barrier for some folks, and to give empathy to those folks that might be struggling to reach out.
So extremely important point, and it's something that I hear about as well. So how do we as professionals help people overcome that, maybe when they show up, or at least they try to get their feet wet? Because sometimes I do get people who are like, I'm not sure, I didn't want to come here now, but someone's made me come, I'm going to check it out and see if I stay. So how do we help them as professionals and to help them overcome this when they show up at our door? I think it's important to let people know.
So I want our audience to know, and others in the mental health community, that the relationship with your provider is the most important part of treatment. You can have the most educated, experienced, credentialed provider, but it's all about feeling like they really hear you and they see you. And so as the client or as the audience, I want people to know that their provider should make them feel seen and heard, and not question, how long did it take you to get services? Why did you wait so long? Or why don't you just tell your mom to stop badgering you, right? Like there's this really important cultural and family context here that your provider should be aware of. And so for the audience, get a provider that really understands where you're coming from and wants to learn about your lived experiences. And for the providers, meeting clients where they're at, right? That we might be thinking about, okay, we can do this, and this. Let's slow it down. Let's meet them where they're at. Let's understand what their lived experiences have been and what has brought them here, and making sure that we meet them where they're at, which means we don't have to schedule the next 5 sessions. What if we just get through today's session? What if we just try today? And then you can see how you feel. And if you want to come back next week or next month, we can talk about it. But make sure that as the provider, you're not adding that pressure, right? Of, okay, so now I need you to commit to this and do all these things. Let's just meet the client where they're at. If they're ready, that's great. If they're hesitant, let's go with a slower approach.
Thank you so much. And what I keep hearing from you today is the recurring idea of being present and keeping the door open. I'm hearing that again now as you're speaking about that, to allow people to walk in, leaving the door open, even meeting them where they are is a form of being present and keeping the door open. So if they get through today, maybe they'll come back again and again and again. On my end, as a psychiatrist with medications, I get a lot of people who are like, my therapist has asked me to come. I don't want medications. I don't even want to know, but I just want to talk about it. And I find it really, really important also to say, okay, just because you're seeing me doesn't mean you have to take medications today. How about we just do an assessment? We see if you even need medications at all. And even if you do need them, you don't have to take them today. How about we just talk about all of the options? You go home, right, and think about it and come back if you choose to start something. I find often in my practice that helps people feel comfortable, that helps them feel open and empowers them, because ultimately they're reminded they're in charge. There is no medication that goes in anyone's mouth unless they actually pick it up and put it in their mouth. I often have to remind people of that because they come in, they're like, I hope you're not giving me medication. I hope you're not giving me medication. I'm just here because my therapist asked me to. And I'm like, even if I did give you a medication, it doesn't go in your mouth until you actually take it. You have to go fill the script. So you're in charge here. and similarly for therapy, right? When they come, the therapy only happens if they make the next appointment, and they make it. One thing that I find interesting but also empowering for my patients is reminding them that they're in charge. None of this happens without them walking in the door, making the appointment, taking the meds, sitting for therapy, talking.
Yes, and ask questions. I get so many questions about therapy and about psychiatry, medication, interventions. Let's talk about it. Ask questions. And I have a very similar approach of, let's just get through this one session. Let's see how it feels. Maybe you can go meet with a psychiatrist, go for one appointment. Same thing. You don't have to take the pill. You could see what they prescribe you, see what they recommend. You can reject it or accept it. You are so empowered to do that, and also empowered to ask questions, because the right provider is going to field all of your questions. And so one question I get a lot is medication going to make me feel different? Is it going to change my personality? Right? Questions like this, or how is therapy going to help? Like, isn't it just a matter of taking medication and feeling better? All of these questions are reasonable to ask, and I want to encourage our audience to ask your provider any and all questions, because that is what we're here for, right?
Absolutely. That's literally our job. Why we show up every day is to answer these questions and help hopefully be partners in guiding people to wellness. Thank you so much for sharing with us your wealth of wisdom today. Are there any other thoughts or things you'd like people to learn, things we haven't touched on today? I always just do this as my hand on the door handle before we leave. If someone's listening, is there something you want them to go away today, or any thoughts we didn't get to share so far?
Just reach out if you have any questions. And so you can look up my practice. The website is mindfulccnj.com. Mindful Connections Counseling. We're on Facebook, we're on Instagram. Check us out. If you have any questions about mental health in general, please call or email us. We are here as a resource. Myself or my office manager, Rima, we love to chat with people and give them ideas and resources and answer questions. So anything that comes up, please do reach out to us.
Thank you so much. And that will be most of it for today. We've been talking today with Lauren Grossbach of Mindful Connections Counseling about how to help a loved one who's depressed, how to help them feel confident, reaching out for help, how to identify them in the first place, and help them navigate the care system. Thank you for chatting about that today. That would be all. Again, I'm Dr. Akinronbi, psychiatrist and founder at BrightMindsMD, service in New Jersey and New York, where we help people with depression, anxieties, and other kinds of disorders feel better using fewer medications and wellness practices. Thank you again for your time, and I hope you've taken one or two things away with you today. Thank you again, Lauren, for joining.
Thank you.
Thank you.
Thank you for listening. Don't forget to share this with a friend or two. Until next time, it's Dr. Bolanle on the Bright Minds MD and Your Mental Health podcast.